it's Dr. Denke at Select Spine and Sports Medicine here in Friendswood today with a baseball player, Mr. Reed, and he has a strained hip flexor and adductor. So he went to the orthopedic and had all the testing done there, and they referred him out for therapy. So he's been doing some stretches and exercises rehab here in our office.
Go ahead and just do that once I take that. Great. Do it one more time, keep that knee straight. There you go. Okay. Good, make your arm straight. Yep, so now the band around your shoe. Good. 5, and then now to the side. Do 2 more. 1, 2. There you go.
How's that going with you?
It's going good.
Good, good.
Yes, sir.
I feel like that's helping.
Yes, sir.
And then in here with me, we've been doing some soft tissue work. We've done some hypervolt on the quad and active release and stretching. So, and also some manipulation of the hip joint. Now today we're going to go through some of this active release and dig in here a little bit. So what I'm going to do is apply some pressure in here to the hip flexor. And we're going to hold here, and then I'm going to have you go ahead and slide your foot down towards the end of the table there. Good. And then come back up and repeat. So we're stretching that hip flexor a little bit as I'm holding the pressure on there. How's that feel to you?
It feels good.
Don't lie.
It hurts a little bit.
It hurts a little bit, but it helps in the long run, right?
Yes, sir.
Now, how'd you feel after the first treatment when you came? This is third treatment, by the way.
I felt good. I was a little sore, but
Right.
it felt good.
Good, okay. And then we gave you some exercises the first time. Did you do those at home?
Yes, sir.
On your own? Good,
Yes, sir.
good. He wants to get better. That's good. And second time you came in, we gave you some new exercises, right? And how were those?
They were a little difficult, but they helped a lot.
Good, so progression. And then today you did some more exercises with Jericho, right? New ones.
Yes, sir.
How did those feel?
Those felt good.
Good. What's the hardest one?
I think the bands are the hardest.
Yeah. Gotta add some bands to it to make it more difficult. We want him to get better faster so he can get back out there and play. Relax. Good. Okay. Now, let's cross you over here. Now I'm gonna work more on the adductors. So we're gonna go here. Gonna push down. Is that okay? Oh yeah, now he's gritting his teeth a little bit. Good. What hurt more, this or going down? This. So here we're stretching the adductor group. Before we were kind of taking those hip flexors through a range of motion. How did you do this? How did you injure this?
Sliding in the second base.
Sliding in the second? You're not supposed to get injured doing that.
No.
Were you out or were you safe?
I was safe.
Oh, perfect. That's kind of okay then.
Mm-hmm.
Did a run score when you slid in the second?
I scored after sliding.
Nice. All right. We'll count it okay then.
Yeah.
We'll take a little injury on that. Now, how long ago did this happen?
Like 4 weeks ago.
It's been 4 weeks. Wow. And what'd you do between the injury, going to the orthopedic? What'd you do between then? Rest?
Just rest. Yeah, I sat out and
That wasn't working.
Mm-mm.
No. And you did that for what, about 3 weeks before you came in here?
Yes, sir.
And the progress that you made between the injury and the 3-week mark, and then the 1 week that you've been coming here was
a
lot more than 1
Yes,
week?
a lot more.
Good. Rest isn't always the answer. You know, when you injure a muscle, get tired of it, Jared?
My neck is hurting me.
Jared's neck's hurting. She needs me to work on her next. That feel all right?
Mm-hmm.
Good. All right, now flip over on your stomach. We're gonna stretch the hip flexor here. Good. Want to switch me spots? Here. Just keep that nice and relaxed here. Relax here. I'm gonna pull the leg up. Good. That feel okay?
Yes, sir.
Okay, we're gonna do a little bit more tension on it like that. Good, down. Let's do that one more time. Relax here. Good. Pull you up. Good. Here we're stretching a little bit more of these hip flexor muscles, the quadricep rectus femoris, psoas iliacus. Doing all right, Jerry?
Yes, sir.
You're doing good too, Mr. Reed.
Yes, sir.
Just checking on Jerry's neck. Good, relax. Okay, now flip over on your back. So now we're gonna do some hip manipulation here. We do it all here in the office. Rehab, soft tissue work, adjustments. Now, yes, I'm a chiropractor, but we haven't even touched his neck. How about that? All right, relax the hip and knee here. Good, just relax right there. Good. Let that knee drop down. Good. Good. Okay, just keep it relaxed. I'm gonna pull the leg down. Good. Good. That feel okay in your hip?
Yes, sir.
Good. All right, drop that there. We're gonna check this motion here. Coming up like that. Any pain right there in the front? With that?
A little bit.
A little bit, okay. Let's check this motion here going out. No pain with that?
No, sir.
Good. That's a lot better than you had on the first day there for sure. Cool. All right, let me give you a hand up. All right, thanks for watching. Be sure to like this video. Come back and see us next time.